Over the course of my life, my work has really focused on HIV prevention and care, treatment, adherence to medications. My work has since morphed into looking at wider issues affecting the LGBTQ population, of which HIV is one small part. The variety of my studies that have been funded by the NIH and by other entities has really tried to assess what are the factors that drive risk behaviors in people, right? And it's very much tied to the ideas that I have in the book, Maggie, which is this idea that human beings are not always rational operators. They make decisions sometimes that are not in their best interest or in their health. And figuring out how we in public health and we in clinical care can develop interventions that address people where they are, where they live, within their culture, within their language. And I've been building that around HIV work for 25 years, and more recently, interestingly, since maybe not so interestingly, but maybe not surprisingly, around vaccination, in the LGBTQ population over the course of the last 5 or 6 years. So that's my work's really focused on, and I think it cuts along three domains. The research, of course, the scholarship, doing good scientific, rigorous work, to the translation of that to educational programs for students so that they're prepared to go out there to work with people who are affected by HIV or other health issues that affect segments of the population. And finally, community engagement. And by that I mean is really actively working with the people who we're studying to bring to them the power, the knowledge, the skills that they need to keep their lives healthy. And it's never an afterthought for me. It's always sort of the motivation for all of the work I've been doing for the course of the last few decades. I mean, politics did kill us then. As a young man growing up in New York City at that point, right? So I was watching the devastation all around me. I was doing my undergraduate degree at Columbia at that point. I was seeing friends get sick. I was seeing larger social circle get sick. And I was seeing an administration, a federal administration, certainly at the presidential level, but also at the city level, kind of like turning a blind eye to what was going on. And we felt like we had no choice but to act or to act up, right? And so what was really remarkable about that moment, you can look back in retrospect and say, that was a moment of great horror, and it was a moment of great horror, and it was a time of great fear and of great uncertainty. And, what people forget is that when we think about COVID, we knew pretty quickly what it was, and we knew very quickly how to manage it, and we knew very quickly how to have a vaccine for it. Let's think about HIV. We didn't know very quickly a lot of things, and in fact, 45 years later, we still don't have a vaccine for HIV. Right? That sort of tells you what you need to know. But in retrospect, it was also a time where we learned about community mobilization in a way that I think informs public health in a very real way right now. So it was a time where community mobilization was in response to what you're asking about, the lack of political will to address a disease that was affecting segments of the population that were ignored, right? And I jokingly say this, but I think there's great truth in it, that if HIV were affecting, middle-class white babies, at the beginning of the epidemic, there would have been a much quicker response than there was, because it was not affecting people that the general population were aware of. The gay community, immigrants, injection drug users, these others that are sort of at the fringes of our society. So it was devastating. So that lack of apathy, I think, led to, or I would say it certainly led to, the proliferation of infections. With lack of information, people didn't know what to do. We didn't know. Who knows? Do you touch the toilet seat? Do you touch the doorknob? Is it about the number of partners? Is it about amyl nitrates? What is it about? Finally, we have this breakthrough in 1985, 1986 with the identification of the virus, the identification of the test. And then it was, I think, through the will of the people who were affected, including ACT UP and others, working with great leaders who at first was not Tony Fauci, but eventually became Tony Fauci, all right, to develop medications where community members were at the table having a conversation. And then in 1988, we had the first medication, AZT. For better or worse, it was a medication. It was better than nothing. And eventually by 1996, through that will, through that demonstration, through that demanding that people pay attention, we had medications in 1995, 1996 that transformed the epidemic, right? That transformed the disease from one that was a death sentence to one that became a chronic condition. So it was the response to politics, I think, that brought us to this point. I wish more quickly than it had, but certainly it did have an effect in that period in getting us to the point where eventually we got to in 1996.